I'm Dr Liz Harper. I'm a geriatrician at Wolper Hospital. I also work in geriatrics at St Vincent's Public and at St Vincent's Private, and I've been in this area for a long time. Look, it's a really interesting question because I don't think a lot of people realise what geriatrics is, even a lot of older consultants. It's a relatively newer specialty, and what it is we're involved in the holistic care of a patient. So we're looking after patients, trying to prevent and treat diseases that the elderly get. We want to prevent disability, and we look at the whole patient, so we're involved in their spiritual, medical, physical and socio-economic factors that make up the whole individual. So it's sort of a general medicine for older patients, that's what I describe, but it's much more than that. We work very closely with a multidisciplinary team, we're part of the holistic care for a patient. So it's a bit unusual. So it's a bit different to the single organ specialist that most people have their cardiologist. We work with cardiologists, but we also want to deal with what makes the whole person. Look, I first did geriatrics when I was a junior doctor at Prince of Wales Hospital, and I really actually love the patients. It's a bit corny, but I love the old stories. I love the medicine. It's very interesting. Every patient was a puzzle. And I think, believe it or not, I wanted to be an ONG specialist. I thought obstetrics was the way, and then I did geriatrics, and I really love the environment and working on a team. And so that was a long, long time ago. And since then, I think I've kept, because geriatrics is it's general medicine, but every patient is different. So every patient is a puzzle, something different about them, a story. Putting the medicine together is fascinating, and so I'm really lucky that I wake up each day and think, oh, I love, what am I going to do at work today? And the other thing with geriatrics is we work within a team. So I'm always around people. I've always got, interesting staff, physios, and I think that means it's a very interesting job. So I wouldn't have chosen anything else. But definitely not obs and gynae. Start very early, and I'm based in the hospitals, so in aged care you really have to see your patients most days. Things can change from one day to the next very quickly, so really my whole day is spent doing ward rounds. I really try and see my patients either daily or secondly daily, depending on their acuity, and I work at the 3 hospitals, so that really sums it up. The afternoon's usually seeing other specialties patients that have geriatric issues. We consult a lot, and then really that will go the whole day. So I only really sit down and eat when we have a meeting. That's my day. Probably initially was my father too, which is really interesting, and I had to think about this one, but my father's actually a plastic surgeon, so someone very different to what I do, but he always said, you've got to really enjoy your job, and he loved his job. He only just retired at 76, and I think that was my greatest influence. I chose a job that I really enjoyed. Might not be the most financially rewarding one, but every day is different, and I think that was my greatest influence. And then as I've gone through, of course, I've worked with very strong geriatricians. Geriatrics is it's not really a textbook. We work with other specialists. I've worked with Gideon Kaplan and Professor Tony Bro when I was younger, and those are the people that really inspired me, Professor Gonski. And then throughout, I think probably now who inspires me are the strong female colleagues that I work with, who, not in geriatrics, but in other specialties, who maintain a fantastic practice and really kind, compassionate care that can manage a family. So there's a little cohort of female specialists who I work with at St Vincent's who are absolutely amazing doctors, and I would aspire to be like them. Oh, look, I think I'm really lucky to work at Wolper. I know that's a bit corny as well, but Wolper is a very special hospital. There's nothing really like it. I work in lots of different places. I think the advantage at Wolper is that it offers a type of care for a patient that is a little bit different. Of course, we have our rehab ward where we do orthogeriatrics, but downstairs we have a medical geriatrics unit, rehabilitation unit, where we can look after frailer patients, patients with complex medical issues. And these are patients that we probably would not normally manage in mainstream rehab. We work closely with the community, so we help promote their independence and liaise them and coordinate their care back when they go home. So it's really lovely for me because I can see the patient when they come in acutely unwell, and I get to follow them through their journeys, and they come to Wolper and they all get better and they all go home. And it's a really fortunate thing as a geriatrician to be able to follow those patients. Look, I think it's very hard, that one, and I think it's probably from my father, who, as a surgeon, always said to me, treat everyone with respect. Everyone's exactly the same, and treat everyone with respect and kindness. And he always sort of gave me that piece of advice, and never get caught up in the hierarchy of medicine. If you treat everyone the same, you'll get far in life. And so I've sort of tried to carry that through in my practice, and I think that's easy at Wolper because everyone's on the same footpath here, but that's followed me through. So hopefully I can teach my boys that. Oh, this is a favourite one amongst the geriatricians, and look, I think number one is keep moving. I get a lot of people who say to me, how do I stay young? And I say keep moving, because if you stop moving, particularly in aged care, it's hard to restart. Once you lose your muscle bulk, it's really hard to regain it. And so I think that's one of the biggest tips, is to keep moving, keep exercising, go for a walk, and maintain muscle strength. So that would be my number one. Can't say I follow it myself, but I very strongly am an advocate of regular exercise. The next one would probably be keep social. Really, I think that's the biggest thing, particularly at these times. Social isolation in our community is going to be devastating, and that's what really worries me about COVID. We believe that talking to people, keeping your mind socially active, is part of one of the dementia strategies. And when I see my patients, those who I really worry about and those who deteriorate are the people who are socially isolated. So having a friend is vital, and I think this is what's going to be a problem post-COVID. So that would be my number one. Going to the coffee shop, having a friend, having a chat makes a big difference. And of course the final one is, we talk about use it or lose it, so that's using the mind. But interesting, that's not my number one strategy, but it's where we say keep reading, keep your mind active, and they're the 3 tips for healthy ageing. Well, look, I think we're really into difficult times, I have to say. I think everyone's worried about the mental health of our community, but in geriatrics, it's even more of a concern. We use strategies to prevent social isolation. We have strong involvement with the community, and a lot of the community groups aren't working now because of COVID and the situation of not having community centres or groups open. And what I'm really worried about is the mental health and the isolation of our patients as we move forward. I think it's going to be a serious problem in aged care. Normally I would have a patient who might have a bit of cognitive impairment or a bit of mood, and I would recommend to them going to COA or coming to Wolper for exercise classes, and unfortunately I think they're the situations that we're going to struggle with in the future. So how do we target social isolation and depression in our older patients, I think needs to be a priority.